All right, good evening, everyone. My name is Andrew Henley, and this is a presentation of three organizations, the Lawrence County Historical Society's programming, located in Newcastle, Pennsylvania, and Pleasant Hill Historians and Westminster College. The presentation this evening is going to be regarding the health of Lawrence County immigrants, presented by Ryan Armstrong. And we'll go through all of these individuals that are participating within this. As you will come to realize, local history involves a lot of individuals. And so we appreciate everyone joining us tonight. So without further ado, let's go ahead and get started with the Lawrence County Historical Society. Jamie Jones is on the call this evening. Jamie, do you want to go ahead and introduce yourself?
Good evening, everyone. My name is Jamie Jones. I'm the administrator of the Lawrence County Historical Society. Here I go, stuttering over my words again. Our mission is to preserve, protect, and promote local history through the preservation of various artifacts, photographs, documents, and other historically significant items. And we are more than happy to present these internship presentations for the evening.
Thank you, Jamie. Claudia Manley, our volunteer coordinator. Claudia, you'll have to unmute yourself.
Sorry about that. Good evening, everybody, and it's good to see you, Ryan. My name is Claudia Manley. I'm the volunteer coordinator for the Historic Society, which is a fairly new position within the society. And my role is really to seek out various volunteers that can help us with all of the projects that we have going at the Historic Society, whether it be from a research perspective, from computer skills, just a plethora of different types of volunteer opportunities. So if any of you are overly motivated, please give me a call. I'd like to chat with you because I'm sure we have a great fit for you to volunteer with us.
Thank you, Claudia.
Yeah.
Our next organization that we are partnering with this evening is Westminster College. Harry is on the call this evening representing Alumni Council's Young Alumni Committee.
Yeah, thank you, Andrew. Welcome everybody. So my name is Harry Biddle. I'm a 2014 graduate of Westminster. I majored in financial economics and now work for PNC down in Pittsburgh. I recently joined the Westminster College Alumni Council in the Young Alumni Committee. So our goal is to just have a very good representation of young and recent alumni from Westminster. Engaging within Westminster events, supporting different community events, it's really good to be here. It's really good to see a lot of people on the call, from alumni to volunteers and everybody. So welcome.
Thank you, Harry. Also representing Westminster College is Dr. Balzon, Dr. Clark, Dr. Winters, who I believe is on the call this evening. Dr. Winters, do you want to introduce yourself?
Sure. Hi, everybody. Yes, my name is John Winters. I'm a visiting assistant professor here in history here at Westminster College. In my own work, I am a historian of Native America, and I've worked for the past 9 years in various capacities at museums and public historical institutions, large and small. And in general, I'm very excited to see student engagement, particularly Westminster student engagement, not only with local history, but in thinking about how they, in very creative and innovative and interesting ways that, of course, branch off in a million different directions and possibly can branch off into a million different other public historical projects, the ways that students bring together the humanities and the science for not only public consumption, but in some cases, the public good. So I'm very excited to be here.
Thank you, Dr. Winters. Also representing Westminster is Dr. Martin, the Professor of History and Chair of the History and Philosophy Department at Westminster, and Jen Huff, who has been integral in setting up a lot of these internships for the Historical Society and Pleasant Hill Historians. And myself, I'm Andrew Henley. I'm the president and founder of Pleasant Hill Historians. I'm a 2017 Westminster College alumnus. I'm also on the board of the Lawrence County Historical Society. And so if you see how all three of them coordinate, here's how, if you didn't get it already. But I appreciate you all being here. I want to introduce my colleague and a former intern herself, Gabby Lucas. Gabby?
Hi, everyone. Like Andrew said, I'm Gabby Lucas. I am currently a senior at Westminster, majoring in political science and history as a double major. And like Andrew said, I work for him as an associate historian. And with that, I have worked on various projects that Andrew has headed, including the Cascade Park Reevaluation Project, Quakertown, and basically anything else that Andrew can think up, which, if anyone knows him, is quite a lot of different things. So
Thanks, Gabby. And Gabby has also been a co-author in our two publications that we did publish, which included the National Register reevaluation for Cascade Park, which was successful. We've also partnered with the Museum of Modern Art in New York City, the Society of French Protestantism in Paris, France, the Louis de Silva Ribeiro Public Library and Regional Archives in Terceira, Portugal, the Yon Departmental Archives in Auxerre, France, the Huguenot Museum in Rochester, England, the Pennsylvania Historical Museum Commission, the Lawrence County Government, Arts and Education at the Hoyt, the Lawrence County Historical Society, the City of Newcastle, Sense of Connection, Youngstown State University, Slippery Rock University, and University of Pittsburgh and Carnegie Mellon University. We've provided internships for students at Chatham University, Clarion University, Duquesne University, and of course, Westminster College. We'll be offering some internships in the spring. And so if you're a student and this is of interest to you, just get in contact with myself or Gabby. I do have to do an obligatory thing real quick, which is just going to be a quick snapshot of everyone here this evening. And so go ahead and smile. Okay. There we go. Awesome. Thank you all. Let me go ahead and share my screen one more time. Just a little bit of housekeeping. Our agenda for this evening will be these introductions, and then the presentation will follow. We'll have a Q&A session afterwards, and during the Q&A session, you'll have the ability to raise your hand or even put in the chat your question, and I'll call on you, and then you would be able to ask the question of Ryan this evening. This will be recorded and posted to the Lawrence County Historical Society's YouTube page afterwards. And please mute your microphone when you are not speaking. Now we'll do a quick prize for the farthest participant, and I think we might have somebody on the call that has won the last two ones. And so if you want to, we have Ocean City, Maryland. If you want to put in the chat where you are all tuning in from. We have somebody from Pittsburgh. Of course, Newcastle, Sydney, Australia.
Gibsonia.
Gibsonia, just outside of Pittsburgh. Awesome. Well, we have Newcastle as well. So I think Sydney, Australia wins for the third time running. I appreciate Mariah joining us this evening. She is a Westminster grad as well. And so it's awesome that we have world coverage for this presentation. And Ryan, you're under a lot of pressure for this, but I will turn over the mic to yourself. I'll stop sharing my screen and give you the opportunity to share.
Awesome. So I hope you're all having a great Thursday night. My name is Ryan Armstrong. I'm a double major biology and history double major at Westminster College. I'm a sophomore. And tonight I'll be talking to you about Declaration of Intentions and the health of Lawrence County immigrants. So what is a Declaration of Intention? A Declaration of Intention is considered the first paper in the citizenship process. An individual must have resided in the United States for 2 years before applying for a Declaration of Intention. 3 years after the Declaration of Intention was submitted, an immigrant can submit for a petition for naturalization. And if that is granted, a certificate of citizenship is granted, and an immigrant becomes a citizen. In our data set, there are 20 volumes of these Declaration of Intentions, which date from 1906 to 1972, which are all from the Court of Common Pleas in Newcastle. While this does go from 1906 to 1972, primarily 95% of these volumes are from 1906 to 1945. And the last 25, 30 years really drop off in immigration. And the Declaration of Intention includes the name, the age, the occupation, the color, the complexion, height and weight information, many dates, residential information, family information, and a lot about an immigrant. So with this sort of data set, a lot can be done. And currently the Historical Society holds the Declaration of Intentions for the county. So yeah. So next, the data set improvements. So the data set itself, the data was scanned into a Excel spreadsheet. There are 20 different volumes in it. And so first of all, the first improvements were the verifications of these Declaration of Intentions, which involve making sure all the data is so accurate and avoiding typos and factors like that. But as there are 20 different volumes, while it was a great setup for genealogy aspects, the problem was that many of them had separate formats that when compiled together had a hard time being used in Excel functionalities. So one of the things I did with this project was I reorganized the database to really be effective for statistical projects through Excel. And in doing so, there are a lot of instances where immigrants did not have all of the information. And if they did, there were errors. So for this example, I'll get to some of the details in this exactly, but we're talking about body mass index, which we'll get to. You can see that some of the individuals did not have a height or weight, which would provide an error for the body mass index, which is already problematic. So a funny story with how problematic this could be is this person right here, Joseph 1301. He was listed at only 7 inches tall, which is obviously a typo. No one is 7 inches tall. And his body mass index was 2008, which for reference, a value of 30 is obese. His reference was 2008. So when I was first organizing through the data and trying to find trends, I remember I was talking to Andrew and we were looking at this individual is Polish and he signed his Declaration of Intention in 1923. So when we were going through this, we were talking about, oh, Poland's a very interesting topic. What's going on with Poland as a very abnormally high body mass index? That's really weird. And we were analyzing all the different Eastern European nations and the cities through Poland. Andrew was getting excited. He started talking about sending me to Poland. It was really interesting. And then one night I'm going through all these data and I realized all of the data and all that error is just because this one individual did not have a 5 in front of or a 6 in front of their database. It was just 7 inches tall in the 2008 body mass index value. So that really shows how, and obviously that broke that idea of going to Poland and all the trip and the research with that going. So it really shows how important each little detail and number is important in a data set that includes 8,600 people. Every single number matters. So the verifications and cleaning up of this data is really important to making it useful. So beginning with the project, a lot of the work is done through body mass index. So to begin, it's really important to understand what body mass index is. Body mass index is a very common tool which uses the height and weight of an individual to calculate a value, which is commonly used to predict health. The formula is just kilograms over meters squared. And while there are limitations to body mass index on an individual basis, because it cannot differentiate muscle mass from fat and a couple other factors, it is a solid predictor of health when used with a careful lens. An individual who are obese with a high body mass index have higher likelihoods of all causes of death, heart disease, stroke, diabetes, mental illness, and more. And conversely, abnormally low body mass indexes also have high mortality rates and large problems associated with them. So you can see with this example here, under the CDC guidelines for adult body mass index, under an 18.5, it would be considered underweight. The range from 18.5 to 24.9 is a healthy weight, and 25 to 29.9 is considered overweight, and 30 plus is considered obese. And this weight range here is for an individual who is 5'9". So if they were under 124 pounds, they'd be underweight. If they weighed between 125 and 168 pounds, they'd be a healthy weight. If they weighed between 169 pounds to 202 pounds, they'd be considered overweight, and 203 pounds or more, they'd be considered obese. So with that in mind, some of the first analyses were the yearly trends of body mass index of immigrants per year, as well as just the number of immigrants who signed the Declaration of Intention per year to see the waves of immigration. So with this trend, it is important to notice that the body mass index values, they are not when the immigrants entered the country. It is when they signed the document, which is a couple years after they entered the country. But as you can see, starting in 1906 and ending in 1944, there is a general rise in body mass index, starting about 24 and ending about 26, with a peak at 27 around 1941-42, which is very interesting. It says a lot about society at the time. At the same time, you can look at the number of immigration, the signing of the Declaration of Intentions to see how many are immigrating and becoming citizens in Lawrence County. It can be seen that there are spikes on the early 1920s, especially in the 1910-20s regions, especially like 1920-24. And even around 1940, which as you can see is the highest peak of body mass index, around 70 or 27, pardon me, is where there is a spike in the number of immigrants, which is good because that shows that that is likely not just a statistical anomaly. And you can see that this graph ends at 1944, even though the data set goes to 1972, because you can see the population of immigrants weaning off, and it continues to dip from there. So, yeah. So another interesting relationship is just looking at the body mass indexes of immigrants compared to where they came into the country from. This can be done for more countries and other factors other than just the per country of origin. That is one I've picked. But it is interesting looking at how many individuals have come in from these regions into Lawrence County in this time period, as well as their average body mass indexes. So you can see a place like England has 206 individuals, which is pretty significant. One moment. And body mass index is 23.1, which comparing to these is generally actually pretty low. The largest bump in population is that of Italy. It has 3,289 individuals, about 25.4 body mass index, which is according to the BMI standards of the CDC, is an overweight body mass index on average for 3,300 individuals. You can see countries of Germany, Poland, Austria, Hungary, and Hungary, which in itself is interesting because this is just listing what immigrants wrote down as their immigration or their country of origin. So you can see that 566 people wrote Austria, 676 people wrote Hungary, but 95 people wrote Austria-Hungary, which is interesting about the time period that same region is displayed 3 different ways. And there are 3 different body mass index values for that. Russia, Romania, Finland, Wales, Scotland, Ireland, Finland are all pretty high populations for in the data set. So is Canada and Greece. One of the more interesting data, like the immigration countries to me, was Syria, because I'm not a resident of Newcastle and I was unaware of the mosques in the area. And I thought it was really cool that you can see the origin of mosques in Newcastle and the population of immigrants from Syria in this data set. That's really cool. That's really interesting. So looking at this region, you could look a little bit more specifically. Looking at what's interesting in this data set is the regions of the Eastern Europe compared to that of the British Isles is actually pretty different. Looking at, for this table, we considered Poland, Russia, Austria, Hungary, Romania, and Czechoslovakia as a large population of that Eastern European countries. And the body mass indexes are all between 24 and 25, especially the higher range of 24 and the 25s, which borders on or is overweight depending on the country. But when looking at the countries of the British Isles, which still, if you looked at the previous slide before, have pretty sizable populations, right? It's not just statistical error, purely. About 500 between all 3, or all 4 of them. The body mass indexes are all in the 23s or low 23s, which is very interesting that you can see the difference in body mass index between Eastern Europeans and immigrants from the British Islands, which is interesting. In the bottom right here, so what this is this is Yatsenica, Blizne, Orzeówka, and Starajvis, pardon, hard to pronounce, but this stands for individuals who came from this city, and these individuals wrote different countries when they came from the same city, which is very interesting with the politics of the region. That if you look at Yatsenica, 17 immigrants said they were from Austria, 46 said they're from Poland, one said they're from Italy, and one said they're from Austria-Hungary. They all came from the same city, but they all listed different, many of them listed different countries of origin compared to where they came in from, which is a lot about the politics of the region and the time. It's a very interesting idea. So an overview of my project more specifically, I used height and weight to calculate the body mass index of the individuals. Then the immigrants were separated upon their urban/rural residential results, essentially meaning when an immigrant came into the country, did they immigrate to an urban area or a rural area, which we'll describe how we determine that later. The body mass index values were compared and analyzed for both the urban and rural populations. And the original hypotheses were if an immigrant resided in an urban population, they were more likely to have a higher body mass index and a worse health outcome. And if an immigrant resided in a rural region, they were more likely to have a lower body mass index and a better health outcome. Therefore, a longer lifespan, and therefore. So some of the previous research on similar topics to this, honestly, they varied. They were inconclusive. Researchers in different studies viewed urban centers having a higher body mass index, lower body mass index, and no effect on body mass index. There were studies on talking about all three. However, it was more likely that if a city was still in an urbanization period where it is not as developed as a modern city today, let's say in America, let's say New York City, they were more likely to have a higher body mass index in an urban center compared to if it was a city like New York City, it would tend to have a lower body mass index compared to the countryside surrounding. And since this region is still urbanizing in the area, that explains the hypothesis that the higher body mass index will correlate to a higher population will correlate to higher body mass index. However, research also suggests that when an immigrant is healthier than their population, and when they move into a city or a region, they will adopt the habits, the lifestyle, and the body mass index of the current geographic residents of the individuals who are in their area, which is a very interesting idea, which will come up more later, but it's very interesting with how America has changed and how population has still grown and immigration has still grown, and what that means for immigrants today. So in determining body mass index values, while body mass index is a useful tool that was used a lot in this project, it should be used cautiously when used as a determinant of health. Because research on body mass index, especially the CDC guidelines, is inconclusive. Or not inconclusive. It's accurate, but it needs a fine-tuning. So the lowest body mass index values, the underweight, tend to be more likely to provide a mortality than the highest body mass index rates, which goes against popular culture. And although yes, obesity does have a higher mortality rate, but the overweight category in the CDC guidelines, that 25 to 30 region, which is often used interchangeably with obesity. I mean, if I said I was overweight, you'd probably think obese, right? It's very wish-wash in how people speak on the definitions. There is a large healthy population in the overweight category, which is not accounted for. A body mass index, in studies I've found, a body mass index between 24 and 27 has been seen at the lowest likelihood of early death and mortality, which is somewhat concerning of the CDC guidelines because the body mass indexes between 25 and 27 are considered overweight. So the individuals who are considered are healthiest in a lot of studies are considered overweight by the CDC and the common definitions of body mass index. So using body mass index that way only as a determinant of health is a bit not useful because you are containing the most healthy and the least healthy groups of individuals in the same population, and it's not good determinant of health. So to try to account for this challenge, to produce the best opportunity of predicting the health of immigrants, other uses of body mass index were still used. So percentiles, which are the, let's say if we're using an 85th percentile, that'd be the top 15% of immigrants are above this body mass index value, as well as a standard deviation of the immigrants' body mass index values. So the average is 25 and there's a 3 standard deviation. That immigrant will likely, on average, will be 3 values different than that average. So a 22 or a 28. And a 5 number summary is just the minimum 25th percentile, median 75th percentile, and maximum values of body mass index value per population in that range. One moment, my mouse is not working for some. Okay. So to determine what the population sizes were, we analyzed urban and rural populations. To analyze them properly, it is crucial to analyze the population density across Lawrence County, as well as understand the definitions of urban and rural populations. So Newcastle is the largest urban center in Lawrence County and in the database. Its peak population is about 49,000 in 1950, and the surrounding regions do not have a close to a similar population. They're very rural. Now, definitions of urban and rural vary, including a population of 50,000 plus is often considered urban, which you can see is right so close to what Newcastle is, because the peak population was 49,000. Generally, the common definition is 50,000. And we're looking at urban influence codes, which are statistics run through the government. They consider a value, they analyze the populations and they say if a value is 1 or 2 out of 12, it is an urban center. And then the 3 through 12 are definitions of rural, with the lower numbers being more urban in comparison. And Newcastle and Lawrence County is a 3 on that scale. So it is just under the urban definition. But since it is the largest urban center in the region, and it is so close to that definition, for this data set, we're going to consider it the urban area. And immigrants who move to Newcastle are considered moving to an urban area, while the rest of the immigrants are considered moving to a rural region. So when looking at the data of these immigrants and those assumptions in mind, for the urban individuals residing in Newcastle, the average mean was 25.02 body mass index, which is right about just at the overweight category, but when under the CDC guidelines, but generally it's a pretty healthy body mass index with a standard deviation of 3.13. The minimum is 15.31. The 25th percentile is 22.96. The median is 24.53. The 75th percentile is 26.61, and the maximum is 48.92. And when looking at the CDC guidelines, which are the first 4, the underweight, the 0.44% of individuals are underweight, 55.39% of individuals are normal weight, 37.51% are overweight, and 6.67 are obese. And again, remember that the values for overweight contain that healthy population, so are not completely valid. They are, yeah. But when looking at the percentile, which is the top 15% of individuals in the population, and the top 5%, which is 95th percentile, the average body mass, or the body mass index was at or above 28.06, which is when 27 or 24 to 27 is an unhealthy range, 28 is bordering on an unhealthy. That is an unhealthy weight. 95th percentile of 30.67 is also an unhealthy weight. And here you can just see a graph of that same distribution, the percents. You can see the very small underweight category, the large overweight, normal weight and overweight, with the still small but sizable obese category in the data set. Comparing that to rural data, the rural has a value of 25.01, a standard deviation of 2.932, a minimum of 16.27, a 25th percentile of 23.13, a median of 24.57, a 75th percentile of 26.61, and a maximum of 51.86, with 0.37% of individuals being underweight, 55.79% of individuals being normal weight, 38.25% of individuals being overweight, and 5.59% of individuals being obese, with the 85th percentile of rural immigrants being at 27.76 and the 95th percentile being at 30.29, pardon me. And you can see the same trend on a graph. This data looks very similar, as the percentages are not too different, but there is still a distinction between them that is important. So in comparing them, the key details to look at are, yes, the mean are very similar, 25.02 and 25.01. They're nearly identical means, and the median is fairly similar to that. But the sizable differences are the standard deviation, which is 3.13 in an urban region and a 2.932 in a rural region. And since this value, 24 to 27, is that healthy weight and that goal of the most healthy population, a larger deviation away from that is going to less healthy outcome. So a larger standard deviation away from that healthy value is poor for an individual's health on average. And when looking on this, on the right side, even though the overweight categories for the urban and rural there's actually a larger overweight category in the rural region, with displaying it for trying to eliminate that healthier group in that population. The obesity rate is 6.67% in the urban population and 5.586% in the rural population. So it is a percent higher in the urban population. And when you're looking at the percentiles, the top 15% of urban individuals are above 28.06, but for the rural region, the top 15% are above 27.76. So there is a 0.3 significant difference in the top 15% of individuals. And the same can be said for the 95th percentile, 30.67 compared to 32.29, about a 0.3, difference, which is suggesting that there is a difference in the body mass index between urban and rural individuals, and therefore the health outcomes. So some of the confounding variables in this data is that body mass index is an imperfect measure of health in an individual. I think that's clear in how much I've tried to make it work and eliminate those variables. But even with that work with percentiles and standard deviation, it still isn't a perfect display of health. Things like muscle mass and that are not included in body mass index. It's not perfect. It should be noted that Newcastle is not a massive metropolitan area compared to those used in other studies. Newcastle it's not Pittsburgh, not New York City. It is still an urban center, and I think it is just to be deemed so, but there is a sizable difference between the two. It should be noted that the Declaration of Intentions are self-reported by immigrants, and there is a tendency for when an individual self-reports the data, especially with height and weight, it varies from the actual truth. I have absolutely said I'm an inch or two taller than I really am, or it might be 5-10 pounds less than I am. It happens. So the body mass index values are from immigrants who have resided in America for a few years, but not at the entrance of coming into America. So that is interesting, because if you're displaying how the effect of being in America affects an immigrant's health and where they are in America affects their health, we're not looking at these immigrants when they are just entering the country. We're looking at them after they've experienced this for a couple of years already. So that should be noted that these individuals are not fresh off the boat. They've already been influenced by some American eating habits and standards. The data set is primarily males, as in this time period, a lot of this time period is early 1900s, 1910s, 1920s. And it was necessary for an individual to get into the country. If the male had citizenship and could get citizenship, the women and children could enter. And primarily, the data set was males. So that should be noted. There could be a difference in the body mass indexes of females and the immigrants, but most of them are not in the database. And finally, there's very little statistical analysis of the data with variables such as confidence intervals. Well, there is a very large sample size of the data, about 8,400 individuals with eliminations. It is still there are no analyses of confidence intervals to see how accurate the data is, and there could be more of a variance. The research just hasn't been done with the statistical analysis yet. So overall, with the findings, the data suggests that urban regions contribute to higher obesity rates as a higher percentile and higher standard deviation values. The confounding variables especially the lack of statistical analysis, somewhat not eliminate, but should be noted in the findings that it's not a perfect study, but the data does agree with other studies, and it agrees with the idea that it is important to look at location of where someone lives and an immigrant lives when looking at their health outcome, which is in itself a very important thing to understand and look at study. So on effects today, yes, the times have changed a lot since 1906 and even 1940s and 50s, but sadly, there's still a mass exodus of immigrants into America and other more urban, in comparison, more urbanized regions in the world. And looking at the Syrian crisis and Afghanistan and South America and regions like that, there are still mass exoduses, and the consequences of that still matter. And when looking at the health outcome of these refugees, this could be affected by the area which they choose to relocate to. Because if they go to an area with a higher population density, and that tends to have a higher obesity rate, it is more likely that those immigrants will assimilate to those health habits and have a worse health outcome. And finally, some future ideas and plans for research. So there are future plans to continue the Declaration of Intention health research into at least the spring 22 semester. I am going to be continuing my internship here. The last document is sitting on the desk of the registrar right now. So, but some ideas for that research in the future. We were looking at comparing the international residents of the immigrants before they entered the country and how close they were to a city in the urban-rural distinction with the geospatial functions, geospatial tool, which would be a very important, interesting project, as well as we're looking at the petition of naturalizations, which are the second documents in this data set, which you'd be able to view the change in body mass index over a few years in these individuals being in America, which would be a very interesting project, because that would provide a really good opportunity to see how a different culture changes body mass index, because you'll be getting a 3+ year span of immigrants entering a country and seeing how their body mass index changes. And finally, you could look at death certificates of these individuals and look at how they died, and you could look at heart disease and cancers and pandemics in the nation and see how body mass index and other factors, which there are a lot of variables and a lot of data in the Declaration of Intentions that could assist with that, and see how that affects the death of immigrants in time and the lifespans and so on. And finally, these are the sources I've used. The numbers up in the top left that are just the numbers of the studies. I just did that as a number to make it a little simpler. And I'd like to thank Andrew Hanley. He's Pleasant Hill historian. He's supervising in cooperation. He's great. He's helped me a lot with this. I appreciate this opportunity a lot. I cannot say how happy I've been able to work with them and to continue. I'd like to thank Dr. Patricia Clark, who's my advisor and associate professor of history at Westminster College. Dr. Joseph Balzan, who is my advisor and associate professor of biology at Westminster College. I hope he's doing better. I'd like to thank Dr. Ortiz, who is an associate professor of biology at Westminster College. She's also my global infectious disease professor, who has helped me with some of this research. I would like to thank Dr. Tim Cuff, who's a former professor of history at Westminster College. Jody Claban Isolda from the Lawrence County Prothonary and the Clerk of Courts. I'd like to thank Lawrence County Historical Society and the Melting Pot Project team, which is Claudia Richard Manley, Kathy Didiano Wisnowski, Elaine Cooper Chambers, Mary Ann. I'm sorry, Andrew, I might get your mom's middle name wrong. Exlewski, Henley, Andrew Henley, Elizabeth Hoover DeRizio, myself, and Christina Ruthar. And I'm sorry for any names I butchered. So, yeah. Any questions?
Well, we appreciate this, Ryan. I'm going to go ahead and share the Q&A slide. And so at this time, first of all, great job, Ryan. Great job on your presentation. Again, this is the beginning of research using this data set that we compiled at the Lawrence County Historical Society. As he said, it's around 8,000 records within this data set, and has been compiled by that Melting Pot Project team. We've scanned all of the declarations of intention and then have transcribed each individual one. So at this time, if you want to raise your hand or put in the chat your question, I can call on you and you can ask Ryan your difficult questions. Or you can unmute yourself and go ahead and ask that too, if you choose that.
Yeah, I have a quick question, Ryan. Did you go back? I know from working on a lot of the transcriptions, did you look at the difference between, I know that you calculated the BMI based upon the height and weight that was reported by the immigrant at the time that they executed the declaration.
Yep.
Did you do any kind of an analysis looking at the length of time between when they actually immigrated and that signed declaration date? Because I know sometimes it might have been 10 or 15 years before they actually filed, whereas in other times they filed 2 years as soon as they could. I was just curious if you had thought about taking a look at that.
I have. I do not remember the results of that. It is buried in an Excel spreadsheet somewhere, but I have that run somewhere. I believe it is a pretty long time. I thought it was 4 to 5 years, but I might be mistaken. I could show that to you pretty soon after. I'm pretty sure it's in a Excel function somewhere in a spreadsheet.
Yeah, I'm just curious. I'm just curious if the BMI rates, when you look at it from length of time between immigration and declaration, were they higher, lower, or pretty much the same as the numbers that you came up with?
I remember it being about like 5-ish years, if not more.
I'm sorry.
I can't remember that answer specifically, but hopefully this helps a little bit. I remember looking at the average year of immigration when an immigrant entered the country, and that was about 23, right, which is very interesting.
Right.
So like the data's there. I could run it in 30 seconds. I could do that for you.
No, I was just curious if off the top you had taken a look at that and if you saw any major distinctions in the numbers.
For that individually, no, I've not yet.
Okay, thanks.
No problem.
We had a question from Dr. McMinn. Would you like to ask it?
So are the body mass index standards used here appropriate for the, unless you want to say it, I'm sorry.
That's fine.
Are the body mass index standards used here appropriate for the average height and weight standards for the time when the declaration was filed? I have not individually looked that much at the height and weight like the individual height and weights. Most of my work was putting that into the body mass indexes and doing that. I believe it was, honestly, I don't know. I have not looked that much individually at the height and weight. I use it as a tool with body mass index. That is a very good question. I'm not sure.
And to reiterate the question, it was to clarify, are the BMI standards used here appropriate for the average height and weight standards that were used at the time when the declarations were filed? A question on relative data. That's also a great insight for this research.
Yeah.
Any other questions? Dr. Winters, go ahead.
Hey, thank you. And Ryan, very, very interesting and thorough work. And I love that little rabbit hole you almost fell down with the 8,000 BMI person. And oh my God, these immigrants from Poland are this unique set. So good catch.
I spent too long down the rabbit hole. It hurt. I didn't work for a week after I found that out.
I'm sure. Well, very good catch moving, for the rest of us using this data set moving forward. So thank you for your diligence there. I don't know, this is a sort of comment, I guess, masquerading as a question. You've done a lot here. And I think Dr. McMinn's question about sort of the relative BMI numbers, rates, whatever we want to call them, are an important one, right? We can't really judge present day to something that happened nearly a century ago at this point. It's not exactly the same. But in that question, right, in this trying to boil down and really iron out, maybe hammer out some of the details about immigrants to the county at this particular time, the there's a lot happening, right? The people who are coming over here, you know, there's a depression in the 1890s. Obviously, World War I and World War II had a significant impact on the type of people who are emigrating, and all of these different things. Where they're ending up is obviously a significant portion of this. We also know that when immigrants are being processed at these various ports, say Ellis Island, you know, it's not only an incredible scale of humanity that is moving through these very tight, narrow spaces, you know, but it's also an extraordinary moment where public health becomes a really important part of sort of an American administration and how they think about who the United States can let in and who the United States wants, you know, in their country. So I think it might be worthwhile, which maybe you have done this already, or maybe you've sort of glanced at this already, but it may be worthwhile, you know, moving forward, maybe not next semester, but moving forward, to at least take a passing look to compare and contrast perhaps some of Ellis Island's records to really get a sense of, are they likely they are looking at the exact same data? They're looking at height, they're looking at weight, they're looking at hair color, they're looking at, you know, particularly diseases, which they are very sensitive to. So I would imagine their records are, you know, somewhat sophisticated on that front. So you get a nice sense of, on arrival, right, people from these countries generally look like this. From Ellis Island, then they spread throughout the country, right? They're not coming directly here. They go first to these ports and then they go to these other areas. So that could be a really interesting way to then lead into this other piece, which you were saying, right? Modern studies of BMI, people move into a space and then their BMI changes based on local habits. This is, yes, right? You're living in these spaces and you're living in these areas and you're adopting local culture and food and all these different things. That makes perfect sense. But that also brings up new questions about society and culture, right? Particularly in the early 19th century, you're looking at, there's a tremendous amount of nativist pressure for immigrants to conform, right? So it makes a lot of sense that they would adapt, new immigrants would adapt very quickly to local customs in whatever form this takes. So this project does a lot, right? You're not only looking at health, it also raises these other questions. So I'm curious, as you move forward, right, if you were to return to this project 5 years from now, what direction would you take this project in? What really grabbed you about this that you'd want to pursue further?
So first of all, your idea about Ellis Island, I don't know if you could actually, this is my own personal interest, I don't know if you could personally obtain that documents on Ellis Island, but again, that's a great idea. In this data set itself, you can see the port cities of where the immigrants actually came in from and where they left from, like what ports they left from, which is very cool. And the ship they traveled on to get here. There's a lot of little details like that. How many children, it's a very broad topic, a lot you can do. So obviously I talked about the death certificates, the second document of projecting the body mass index over time, which I think is very interesting, comparing that to death certificates. I'm looking at that right now and I think that's really interesting. So that is probably the first thing to my mind now. If there's another project I think was interesting, you're talking about World War I and the effects of those kind of events. When I've talked about before the cities and how you can see the geography change and what is considered what nation in this data set, because the same immigrants are calling this same city 4 different countries. 4 different. That's crazy. I think that can be investigated in a lot of ways, and looking at the treaties, comparing that to the immigration, where immigrants are coming from, what cities they're coming from. I think that would also be a very cool project. That would be really awesome. But also, I like the public health element. I like the projecting the body mass index over time, comparing it to death certificates and affecting that. Those are both really cool projects. I would love to do at some point. Great question.
Thank you, Dr. Winters. Are there any other questions from the audience that you would like to ask Brian, or even about the data set itself? We have a county commissioner on the call. I would like to call out him only because he's been very active and he's been a great supporter of the Historical Society. So Dan, are there comments that you would like to make as well?
Thank you. Andrew very much. I'm also a proud Westminster graduate, and I serve with Harry on the Alumni Council. No, I tell you, as Ryan was going through his data and his records and his statistics, I kept thinking about the city of Newcastle in particular, and the fact that there was a time, and that time has come and gone, and it's not specific just to Newcastle. I'm sure it's true probably in a lot of urban areas, but 50, 60 years ago, there were well-defined neighborhoods in the city of Newcastle that basically reflected the ethnic groups that arrived here. And Andrew would know all about this. For example, the area known as Sheep Hill, which is part of the 8th Ward, was predominantly Polish. And but not only Newcastle, out in the town of Bessemer in the western part of the county, you had a high number of Croatian folks who had immigrated there to find work. And other parts of the county, you could point to certain ethnic groups that lived in those certain neighborhoods. That's changed, and that prompted me to think about that as Ryan was going through the data. Obviously, the high number of folks who came here from Italy, and that's still true in Lawrence County. We have a high percentage of people of Italian descent who, when they got here, mostly lived in the city of Newcastle, but as years went by, they've moved out into all parts of the county. So no, the nice thing about what you presented, Ryan, it prompted me to think about things, and I'm sure it did for everybody else on here. So congratulations. Thanks, Andrew.
Thanks, Dan. Appreciate you.
Thank you.
All right. Are there any other questions? You're welcome to unmute your mic. I'll give you a few seconds to do so if you have any. Well, we appreciate everyone joining us this evening. And I will give over the presentation to Gabby to talk about our cemetery cleanup day this Sunday. It's supposed to snow.
It's fine that it's supposed to snow. The last time we were there, it was 1,000,000 degrees. So we just go to both spectrums. But so like Andrew said, this Sunday at 2 p.m., we are going to be hosting a visit to Quakertown, which I think most of you were at the presentation last week where Logan talked about the Quakertown artifacts. But we are going to be hosting a cleanup of the cemetery there to prepare it for the potential use of ground penetrating radar in the spring. So we have to clean up just any brush that is there, leaves, things like that. And so if you would like to join us, we would love to have you, but please, like Andrew said, it is going to snow. Please dress for the weather. And you can email me at that bottom email address if you have any questions.
Awesome. Thank you, Gabby. Appreciate that. I did want to say one quick thing before I get to this is that I was just checking Facebook. We have some individuals joining us from New Jersey, Mississippi, and Italy. So I appreciate Mitch Tannehill, Jeff Zubkowski, and also Alessio Mattanini. And so I appreciate you all joining us from around the world. Now I'll hand it over to Jamie or Claudia to talk about the Lawrence County Historical Society. Jamie?
Sorry, Andrew, wasn't prepared to unmute or put my camera back on. Okay, so I have lost my train of thought. For the Historical Society, if you would like to help us out in any manner, we always need volunteers, and financially we could always use donations, and our biggest drive for keeping our operating, like raising money for operating costs and just generally keeping our society going is memberships. The two website links down below, lawrencechs.org/donate and lawrencechs.membership or .org/membership. Those are two manners that you can donate to us or sign up for a new membership. Memberships for individuals usually tend to be about $50. If you're a student, you get a discount to $25. And donations, just again, any little bit helps. And I feel that turning it over to Claudia to talk about the volunteering would be more her wheelhouse.
Thank you, Jamie. Claudia?
Sorry about that. Just somewhat of a repeat of what I stated earlier. We have quite a variety of needs. As Jamie mentioned, we're a nonprofit. And so a lot of functions that other organizations or other businesses would hire someone from the outside to come in and take care of or address, we have to look to volunteers. And we're looking for skilled volunteers, people that are knowledgeable in hardware, software, computer hardware, software, people that are that do research, people that all the way down to people that would be willing to come in and do light housekeeping of the Greer Mansion. And we've been reaching out to various organizations and contacts within the city limits to try to bring in some volunteers to address some of these needs. So again, if you or anybody you know has a few hours a week that they would like to donate, I can surely find suitable employment for them. And if you or someone you know, if you don't have time to physically volunteer, donations always help keep the doors open and the lights on. And you can either reach Jamie or I at any time, Tuesday, Thursdays, or Saturdays. And of course, your best contact is Andrew, because he's everywhere all the time, day and night. I don't think the man ever sleeps. So one way or another, you can always reach out to us.
Awesome. Well, we appreciate that, and we appreciate you all. We want to give a special thank you for everyone who hosted the session this evening. I did want to give a opportunity as a reflection for Dr. Martin, who is joining us currently. Dr. Martin, I'm not going to put you on the spot, but I'm going to put you on the spot. I know that you've joined us for the other two presentations, but if you wanted to talk a little bit about how these presentations are fitting into the larger picture of history at Westminster, I'll allow you the time and opportunity to do so.
Thank you. You can hear me now, right?
Yes.
Yeah, thanks. Yeah, well, that's very cool for you to do. I have to say that what you're doing, Andrew, and the students, of course, is exactly in line with where we want the history department to be moving in the next, several years, and as quickly as we can. To answer the question, what are you going to do with that, right? The question that anybody who majors in the humanities always gets asked. And what we're doing here and what you're helping do, Andrew, with our students is provide really good answers to that. You're showing a pathway from the classroom to these kinds of projects. But the other thing that I think you're doing that is really important is that you're pulling together, you and the students are pulling together on different disciplinary strings, and you're involving different constituencies, of course, academics, but also members of the community, local political leaders, archivists, historical societies. And this is exactly you're modeling for me and for my department where exactly we want to go. And so I'm really grateful to Ryan and to Minch and to the others really who are demonstrating what we really want to accomplish. So kudos to you all. Really good job, good work, but also a really good model. Really, really good model. I'm grateful to you, Andrew, more than I can really say.
Well, we appreciate you, and I appreciate your mentorship through this. I think that what Westminster has really done for myself is given me the opportunity to lead these internships. And it's the students' work and the ability of the students that are really at the forefront. I think that, it's always a good reflection throughout even the Historical Society or in the college or even with my own company now, how history can be the backbone of a lot of these different disciplines. And so if it is working at the Historical Society on something, maybe it is this interest in biology that you have, and maybe it is the interest of how we study health over time, such as what Ryan had presented this evening. It gives you the opportunity to find your niche within history. I always say that every discipline revolves around history. We have to look to what has been done before us, and understanding that layer, so then we can place our own layer on top of it and have a sturdy foundation to do so. So I will want to again remind you of our cemetery cleanup day. And then also I would like to thank everyone who hosted the session this evening. Kara Montgomery, the Senior Director of Alumni Engagement, Chad Surfoss, the new Director of the Professional Development Center, Ed Petras, the President of the Historical Society, Lorraine Petras and Stephanie Felina, the programming co-chairs of the Historical Society, Kathy Wisniewski, the former administrator. And specifically, I wanted to point out, again, Claudia Manley has done a significant portion of this data set. When she started transcribing these declarations of intention, we were probably at 1,200, and then she finished it out at 8,000. And so she spent day and night waking up at 5 a.m. or 6 a.m. or going to bed at midnight or 1, just transcribing all of these declarations of intention for us to really have this data set. So as we saw it within Ryan's presentation, the different applications that we can really use on an academic level, as well as a genealogical level. And so if you have an individual or an ancestor that immigrated into Lawrence County, your family member might be listed within it. I know my great-grandfather is. And so it's a great opportunity for you to partner with the Historical Society or inquire about it. I will say our next presentation is going to be next Thursday at 7 o'clock, and it's by Sarah Small, and it's going to revolve around the North Hill Historic District and focusing on a open source website called northhillhd.live. And so I appreciate you all joining us this evening, and thank you once again for everyone's support. Please share with everyone that you know about our next presentation. It will be our last presentation. But we've had great showings from around the world tonight, Italy, Australia, as well as all across the United States. So I appreciate that. Thank you once again.